Hello, I'm Justin Franson here with Dr. Stephen Dreyer, DC, Newport Beach, California, out of Newport Spine and Sport. Yes, we are so excited to have you. Thank you for joining us.
Yeah, love being here. Glad to join you.
So, Dr. Dreyer and I work closely together. We share the same office, so this is so exciting for me to have him on. Now, not only is he one of the top chiros in the country and one of the best adjusters you'll ever find, he can move energy like a Shaolin monk. He can read blood work like a functional medicine MD, and even better, I think, because he actually spends a ton of time looking at markers and saying, hey, if you're low, why are you low, and why don't we get you into the high marker? He actually invests a ton of his time. He's probably has the biggest heart out of almost anyone I ever met in my entire life, and just so honored and privileged to be sitting in a room with him every day, working on people, collaborating back and forth with him, learning from him, because he's been here for about 30 years practicing in Newport Beach and at this location for almost 25. So guys, one of the greatest in the business, and has such an acute level for working with the feet, and then also on supplementation and recommendations. His intuition is beyond anyone's. He can look at you and just tell you exactly what you need. But today, we're going to dive deeper into the realm of blood work. This is whole body, whole brain. Now, to find a functional medicine doctor that actually meters blood work, measures it, reads it, and takes it, can look at your genetics. There's several markers. There's baseline, there's the dive deeper in. He does that work with all of our athletes, all of my clients, and even more. And so we're going to allow you to learn what he's looking for, what are some of the baselines, the difference between integrated and functional. So I want to turn over to you. Dr. Dreyer, let's hear, what is the difference between functional medicine and integrative medicine?
Thank you. These terms get thrown out there all the time, and there's a little bit of confusion. They do share a lot of similarities. Integrative medicine really has been an effort to integrate, as the name implies, all of these wonderful other attributes of lifestyle, medicine, healthcare, and really in a holistic approach. We're looking at the whole body. We're looking at lifestyle, diet, and exercise, really as never before. And so doctors are starting to realize that what we put in our bodies and what we expose them to is maybe as critical as the drugs that they're supplying and things of that nature. So we're really in this wonderful paradigm shift, and I'm so excited, really, probably more so at this point in my career of 30 years, to be involved in healthcare, because we're really shifting the control and the mindfulness back to us, the patient, and we're becoming better consumers of healthcare. And I think that the allopathic medical model, there's some wonderful attributes. I have some fabulous colleagues in the medical side in the healthcare world, but the truth is things like basic nutrition training, they only get 21 and a half hours in 4 years of medical school. And they've come to realize that's not enough. Somewhat, I always joke around people, it's like saying I'm a Ferrari mechanic and I don't know whether the car runs better on high-test race fuel or peanut butter. And the reality is that health is a holistic approach. We have to be mindful of what we're putting in our bodies, what we're exposing it to in our environment. Years ago, I used to look at patients and say, look, we only have to do detoxification with a certain segment. Now, I think it's for everybody. And the reality is we're being bombarded on all fronts, whether we like it or not. And there's a lot to that. So discussing functional and integrative medicine, there's really two realms there. Integrative is wonderful. We've brought in all of the different things, yoga and lifestyle, diet and exercise, whether we might bring in other disciplines, chiropractic and Ayurvedic and homeopathic and acupuncture and all of these great things, and tied them in with a holistic viewpoint of health, which is wonderful, rather than just targeting a specific illness and let's find that illness, let's give you a drug for it. When you look at functional medicine, we're even taking a much more intense look. So what we're really doing, and what I really appreciate about the healthcare model now, is I've always looked at my patients walking the door as individuals. People walking in the door, they come in with their own unique set of traumas and histories. They have genetics that are their own.
Right.
They are exposed to a different kind of environment in their home. You know as well as I do, with all the EMF pollution and electronic pollution that we have, our environment, the water we're drinking, the air we're breathing. There's over 80,000 patented chemical compounds in the United States. Not one of those is tested for its effect on your hormone system. And we're reaping, sadly, the result of that in increased degenerative conditions throughout the nervous system, the joints, the bodies. We're breaking down, and we're seeing that in increased Alzheimer's, degenerative joint problems, right and left, increased cancer rates all over. Now, we're getting better at managing them, but how about preventing them? And let's give the body better tools and better skills and ability to go ahead and really arm themselves, arm us to help us get through life. Now, when you look at functional medicine, I get a patient walking in the door, I want to know everything about them. I'm not trying to fit a person into my square box, so to speak, whether they're a round peg in that square hole kind of thing. We're going to identify everything about them, and we might even look at genetics. There's some genetic history. About a third of our genome actually codes for enzymes. These enzymes are catalysts for everything that goes on in the body. Every little conversion of food that we eat into something the body can use in a meaningful way often has to have an enzyme and adequate levels of nutrients. So we're going to look at that patient functionally. We're going to identify all of the specifics, and we might use these functional laboratory tests to identify the individual risk. We're going to identify more closely what is causing the problem. I use an analogy, as you've heard, and I haven't come up with a better one, but it's like having a stick. And I use this in a physical medicine sense, but it really applies to functional medicine. If I take a stick and I shake it and bend it and work it, where's it going to break? Well, in the middle, of course. Where's the pressure being applied? Where's the stress coming from, however? Out here on the ends. So I use that to define physical medicine problems that we have, in a sense that oftentimes when we're treating something effectively, whether it's a high-level Olympic sports athlete or somebody who is not that active and leads a sedentary lifestyle, we have to ask, why are we having the problems? Because oftentimes the problems that we have, as you know, are really not necessarily at the point of where the pain and symptoms are coming from.
Right.
We really got to get after what's causing it, because I could put all the Band-Aids and tape and all this, but I'm doing this still, it's going to break. Now, how does that apply to functional medicine? Well, if I am giving you a drug, a specific drug for a specific problem, a specific blood marker, but I'm not identifying all the wonderful systems and the interplay that goes on between these hormone systems in the body, our gut systems, everything, how we absorb nutrients, what nutrients we're taking in, what our lifestyle's like, all that, we're never getting to the causes of the stress. We're just targeting the center point, and we're trying to cover it up. So if we keep doing this more, meaning we're adding more stresses to life, we're going into more deficient states, we're doing this more and more, we're going to have more problems. That means what? We either increase more drugs. Now, in the nutritional world, if we're not really looking at the person individually, we might give them more nutrients for that. We might identify this as a problem, but we're going to give them more nutrients. So if it's a B vitamin, for instance, I'm just going to give them more B vitamins. Well, what happened about the absorption issue? Maybe we're just not absorbing it. Maybe we're not dietary, not getting it in the body in the first place. So let's get after that. And so I think functional medicine is really the evolution of integrative medicine. It's that step further. It's that more intense, deep dive look, as you like to bring up, into the body and what's going on.
That's so fantastic. I mean, we're looking at the actual causes and not just the, focally where your symptoms are. It's like, oh, it's not just a symptom. Like, what's the cause of that symptom? And that's where you can dive in at the deepest layer. The blood's just fantastic. Today, I got an email from, you'll see it on emfrocks.com, but it markers someone on a cell phone for 2 minutes without a harmonizer, and then with the emfrocks.com product, the cell chip on it, then you see the blood with it. And the blood sticks and stacks, rouleau is what they call it.
It's a mess.
Yeah,
it's a mess.
It's a mess just with 2 minutes on a cell phone, because you have your GPS, you have your Wi-Fi, you have the cellular, you have Bluetooth, like billions of waves per second, and your body's like, what do I do with it? We really see it on the inside. You can see everything on the inside. This person had 0 symptoms, didn't even believe the products worked, went to her doctor and said, hey, I want you to test my blood work. So prick the finger, test the blood work, microscopic test, and boom, now we actually see what's going on in the blood. He can do that with every nutritional marker in your body. So what is the baseline? What are the basics tests you do? And then dive into some of the genetic tests you do.
Great question. Oftentimes I get people coming in with stacks of blood work, their traditional blood tests, and we use all that. That's great stuff. That's a great baseline. It gives us good markers for what's happening with so many systems in the body, but it only tells a part of the story, really. So there's often things that we're looking at. Again, we're asking in functional medicine, why? If I have high cholesterol, and we use cholesterol, a real common scenario right in these days. If I have cholesterol that's elevating and triglycerides that are elevating, and I go to my family doctor, the model has been, and still continues sadly to be, we're going to go on a statin drug. And the statins, whether it's Lipitor or any of the other ones, Crestor, or any of these drugs, obviously can drop your cholesterol. Now, we know that that's just identifying a marker on a traditional lab test, and we're going to simply give you a drug to bring that marker down. It's a very simplified and, quite honestly, an exceptionally lazy way of practicing healthcare. I'll get to that point. It is a lazy way of looking. We're not looking deep enough. So we know now, back when the American Heart Association, Medical Association, years ago declared war on fat is to prevent cardiovascular disease. And it was amazing because all of a sudden we started seeing, if anybody remembers Entenmann cookies, not to slam Entenmann's because I'm sure I ate plenty of those. The reality is that what happened is we took all the fat out of the diet and we replaced it with sugar. And the average stat now is astounding. We're getting 155 to 170 plus pounds of refined sugar and sweeteners in the average diet every single year. That is crazy. So as we've increased the sugar content, what happened paradoxically after increasing or decreasing all the fat is we started throwing all the sugar in. Guess what happened to cholesterol? It went up. Triglycerides, it went up. People's diabetes rates went up. We started having all these inflammatory problems. Everything was going through the roof. Guess what? Wasn't the fat. Still isn't the fat. We need cholesterol. We need healthy levels of cholesterol. We need it to form healthy brain function. Hormones are dictated, the hormone levels in the body are dictated by having good levels of this particular substance in the body. So if we block it, we're going to start having deficiency states. And this is the huge issue. So if we take a different look at that person and we see it trending, and this is what I see, I'll tell people straight up, okay, you go into, we see that basic lab panel and we see your triglycerides going up and we see your total cholesterol going up and your LDL going up, and we start seeing that fasting glucose level going up. The traditional doctor, what I'm hearing back from the patients is, what do they say? We're going to watch that. We're going to watch those because those numbers are getting a little high. We're going to watch it until what? We're going to watch it until we're going to put you on medication. Instead of giving you some tricks and skills and tools, more skills than pills, so that you can avoid all that. Let's start dietarily cutting back refined sugar. Because as soon as we cut back refined sugar, what the body does is it doesn't build up in the bloodstream. The body doesn't feel compelled to release as much insulin. And the body can handle it in a better way, and it won't produce higher levels of triglyceride and higher levels of cholesterol, which are actually a product of high sugar levels. And so if we can reduce that dietarily, guess what? There's no need for a statin drug. Magic! And we've done that dietarily without medication. Now there's some wonderful natural substances that I use There's also other deficiency states. So talking about the blood work, I love to use functional laboratories as well. And I use about 12 different laboratories, and we look at diving really deep. I use some wonderful panels out there that give us a broad spectrum look at all the levels of antioxidants in the body. We look at fat levels, and we look at toxic levels of heavy metals. The number of people walking in the door now with genetic markers that show a deficiency state. There's one particular marker called Mthfr. I see it in about 1 in 5 patients now. That means you don't detoxify very well. So if you're eating fish 2 and 3 times a week and you don't detoxify, guess what happens? That mercury level goes up. And it's thought now that that might be related as part of the spectrum of early Alzheimer's-like symptoms. So we've got to identify that kind of stuff. I like to look at all of the fatty acid levels, omega-3s, omega-6s, omega-9s. We can break all that down. We can look at the gut function. We know now that that old term, I got a gut feeling about something, is incredibly accurate, because when my gut starts to degenerate, then what happens is the brain follows. The brain starts to degenerate. So the fastest way to start to heal the brain is to deal with the gut. The gut is our base of our pyramid, and we've got to fix that as a function, a primary opportunity to improve health, because so many of us are walking around. If you have one exposure to antibiotics, you actually wipe out the gut flora for a year. It takes your gut a year to recover.
Wow.
Your ability to produce B vitamins and to stay healthy is drastically affected. So these lab tests out there go a step further, way beyond what we're getting in traditional laboratories. So I'll look at the traditional laboratory stuff. That's valuable, wonderful information. And then we'll step into the realm of evaluating the gut through advanced testing. We'll look at the blood for chemical compounds. We might look for food hypersensitivity reactions, basically food allergy that we develop oftentimes in conjunction with gut disorders. We'll look at all sorts of markers related to hormones, thyroid function, blood sugar handling related to stress and thyroid. So many women these days are walking in with antidepressants. They're walking in on thyroid medication. They're walking in and they just don't feel good.
Right.
And that's huge. And blood sugar handling is all tied into this. Not sleeping at night. Oftentimes you're waking up at 2 o'clock in the morning. It's because your blood sugar's crashing. Right? So all these things are tied in. So again, functional medicine is about asking why and continuing to ask why until we get to the root of the problem, not just giving you something, whether it's even a natural product, that tends to be a problem too. Some doctors are smart enough now to identify vitamin D, which is fabulous, and I'm grateful that they're picking it up. But what do you do with that information? And what is appropriate to treat somebody with vitamin D deficiency? I often see people down at that below 30 level in vitamin D, and I see it almost every day. And the doctors have said, oh, I want you to take 5,000 a day. That's not enough. You're not even going to move the needle. And you need better evaluation. We need to stick with it, do functional laboratory assessments, track these people, and then we can tailor a program that's specific nutrients. And it might even be affected by genetics, because we're going to look at genetic testing. We're going to be able to identify what is specific for that person, because everybody, as much as I'd like to believe may be different sometimes, we're all different. It's that uniqueness that all binds us together, right? We're all unique. And so there's no one size fits all for everybody.
Yeah, definitely. Well, when I first moved my location athleticism in here, along with Dr. Dreyer at Newport Spine and Sport, I was doing a heavy metal detox, and I was just wrecked. And he's going, what are you using? What are you taking? And so I gave him a list of stuff. And he's like, Justin, what are you taking to flush it out of your system? I'm like, well, I'm doing a detox. Like, I'm taking these things. And he's like, no. Like, once it's in your gut, how do you get it out of your gut? And I just looked at him. I'm like, well, I'm just making sure I go to the bathroom. Like, I'm eating well. I'm not eating things that will clog me up. I'm drinking lots of water. He's like, yeah, but you need another level to clear it out of your system. It's called bentonite clay. He's like, go to Mother's, get bentonite clay, and that'll flush it out of your gut. And then I did that, and the next morning it was like the biggest elimination I've had. And I'm like, and I could tangibly feel and see the really the detox occurring. And it's one thing to pull it out of your brain or wherever they're stuck,
Yeah.
but to actually eliminate it from you and excrete it from your waste is a whole nother level, and that's what he shared with me. So dive into detox. I think detox is one of the biggest things. Everyone's wondering how to do heavy metal detox, well, how to do other detoxes. I mean, just talk about that and how you measure that with the blood markers.
Well, detoxification is for everybody. That's something that I do it twice a year, and I'll spend a good 20 days a year, 2 times, going through a fairly regimented detoxification program. We can't escape it, sadly. I hate to say it, but our environment is flush with toxic chemicals nowadays. We're overwhelmed with EMF radiation issues. We're drinking water that's less than adequate. We're being bombarded with, we're drinking out of plastic bottles. We're getting exposures to hormone mimicry, mimics estrogen through BPA. Now it's getting even worse because now we're out there spending all this wonderful money, hard-earned money buying BPA-free products. Guess what? We're drinking stuff out of BPS bottles, and it's even worse. So there's so many issues, and detoxification has so many levels to it. There's issues with detoxifying from heavy metals, and we'll take that for instance. First of all, you got to identify what it is, and that's where the functional laboratory testing comes in, because if we don't know what it is that we're dealing with and the ramifications and systems and symptoms that are really being affected and driven by this, then we're going to have a harder time to approach, because there's certain substances that we can use nutraceutically, whether we're chelating through oral products, or even if we might progress to having somebody do IV chelation. We might even do that with the help of another doctor, getting them on board to do IV chelation. And those are useful things, but we've got to know what we're dealing with first. So let's take mercury, very common. People talk about mercury and heavy fish intake. So what does that mean? Well, years ago, I used to think that a very small percentage were going to be mercury toxic, and that kind of proved to be the case. So maybe it was about 20% max would have levels of mercury that I wasn't that comfortable with. Nowadays, with the increase, I think, in environmental pollutants and so forth, I'm seeing it much more commonly. And really, I just ask people, if you're eating fish 2 to 3 times a week, you're mercury toxic. And if you have a genetic problem that is going to put the damper on your ability to actually functionally detoxify, because your body can get rid of this at a certain rate. It's when we overwhelm that rate by too much intake that we start to build up problems. Or if you have this genetic issue, this Mthfr that I mentioned, that's a genetic deficiency. And that affects our ability to actually take dietary folate and convert it into a type of B vitamin that the body uses. And it's critical for detoxification. So if I'm to try and get mercury, let's see, somebody has been, and there's different forms of mercury, by the way. So you can have methyl mercury in these different forms. Methyl mercury oftentimes is related to silver amalgam fillings and so forth. It is highly toxic. I have watched a patient who went in, unfortunately, this is somebody close to me, didn't heed my warning, and went and had 6 fillings removed all at once. All at once, and not by a holistic dentist. I kid you not, in 2 weeks this person was babbling and not making any sense. They were basically really struggling to put 2 words together that made any kind of rational sense.
Wow.
And it was an early sense of almost dementia going on. And it was due to a toxic assault by the mercury in the body. So mercury fillings need to come out of the mouth. They need to be done if you're going to do it. And I would consider doing it, do it 1 tooth at a time with a holistic dentist. Now that's outside of my scope, but there are wonderful dentists out there. Find somebody who does a holistic dental approach, and they're certified in extracting mercury amalgam fillings.
Right.
So we're trying to get this out of the body. There's all these wonderful substances. I happen to be a big fan of cracked chlorella and encapsulated cilantro, which can pull it out of the brain. But what do you do with that? There's different mechanisms that are involved with the body. You got to pull it out of the cells, and it gets into the bloodstream, and it's got to clear through the liver, then it's got to get dumped through mechanisms into the gut. So we have to address that process all the way along. There's no one product, unfortunately, that covers all those different processes. You got to remove it from your diet. You got to get it out of the tissue. You got to get it through the liver, get it into the bowel, and then you got to be able to grab onto it and get rid of it. And that's really, it's kind of a 3-step process. So you really got to be mindful about what it is that you're bringing to the table when you do this. You can actually create a very sick person by pulling it out of their body, but then you're not doing anything with it. So I was really blessed to be able to help Justin, and I wish you could have seen a picture of his face the day after when he came in, because one day he wasn't looking too good, and the next day you could tell, and the energy was there, and he's a pretty energetic guy, so I'm trying to keep up with it. So it's awesome.
No, it's true. The energy, and when you do a detox, it can wipe you out for a period of time, but as long as you're flushing it, keeping it going, you'll see your energy levels jump up, and they'll go up 20% more than normally your top end marker once you have them flushed. It'll be the new normal, because a lot of times, especially nowadays, we don't know what feeling good really means.
That's right.
You're so caught in this whole cycle. You're in a spin cycle, and you don't know what freedom is.
Yeah.
You don't know what feeling good is, and we're so we're under so much assault. To have a functional medicine doctor that can read your blood, help you clear stuff out, find the pathways that are blocked, and provide supplementations and diet recommendations or intake recommendations, and get your system to really be strong and have resiliency, you're going to see your energy level shift, your productivity and your performance, and your whole body's just going to come alive. And that's why we're talking to Dr. Dreyer today. So. You guys, thank you so much for joining us on Go Beyond Summit.
Yeah.
Love it. You guys, StephenDreyer.dc.com, StevendReyer, DC.com. DC is the initials for a chiropractor, doctor of chiropractic.
On Facebook as well, so there's some great functional medicine, all sorts of little tips and health-related stuff on Facebook. It's Stephen Dreyer, DC, FACO. I'm also board certified in chiropractic orthopedics and been doing just about everything. I have a huge scope of practice, as Justin knows, and I'm super thrilled to be working with Justin. He's been a great fit and brings a whole level of energy and knowledge of his own in that benefits my patients, and has been awesome. So thank you so much.
Thank you, Dr. Dreyer. Yeah, we just love helping facilitate people, getting them out of pain, but you got to look at the inside out, and that's why, guys, give them a shout, give them a ring. It's going to change your life. Just read your markers, get them taken care of, but have someone who really cares about you reading the markers like Dr. Dreyer. So thanks for going beyond with us.
All right. Thank you.